So as you probably know, epilepsy is a condition where the seizures themselves happen very rarely throughout the patient's life. It may, throughout your everyday experience, seizures may happen for less than 1% of the time. But when they do happen, they can be potentially catastrophic. They may lead to injuries to the patient himself or to someone he may be taking care of, or it may even lead to sudden death, as we know. And at the same time, seizures tend to occur, at least from the patient's perspective, randomly, out of the blue, without any warning possible. And so because of this recurrence, because of the fact that they can be catastrophic and they come out of the blue, patients live in this state of perpetual uncertainty whether a seizure might be happening in the future or not. And this clearly affects their quality of life. And we know this because there have been several surveys from multiple patient sources that show us that seizure unpredictability, which is what we're dealing here, is one of the most disabling factors in people's lives. And so there's a very high interest from the patient group and from, of course, the research field in developing seizure forecasting systems for two reasons, basically. So one would be for patients to be able to protect themselves in advance when seizure risk is high. And at the same time, for people to feel safer and more confident and engage in certain activities that they wouldn't when seizure risk is low. And it looks like these are equally important, these two aspects. So that's why we're focusing on seizure forecasting here.